Hi, it's Dr. Rod from Devoted Vets here today, and our special guest is Poppy. Poppy's just recovering from anaesthetic. She ruptured her cruciate ligament a few weeks ago, and this is a very disabling injury, and the repair for it is a surgical one. Fortunately for small dogs of Poppy's size, the repair is relatively straightforward. Today we're going to talk about the care that pets get after anaesthetic and surgery. The job doesn't end after the surgery and the last stitch has gone in. A lot of care goes into pets when they're recovering. I'm just going to go through some of the steps that we use at Devoted Vets to help the pets recover from the anaesthetic. So you'll notice a lot of things going on here. Number one is a line going into Poppy, and this line goes into a little tube into a vein in her leg, and this is delivering intravenous fluids. And the reason for the fluids is primarily to prevent shock and reduce any drop in blood pressure. We can see that the fluids are pumped in by this special machine here, and Poppy's getting 40 mils an hour delivered from this bag into the pump, down the tube and into Poppy's circulation. A couple of other functions. You'll see a little, what we call a port here, an area where we can give injections. So if Poppy becomes painful, we can give pain relieving injections. Dogs respond to surgery in different ways, and some become unsettled or in pain, and that gives us another option for delivering medicines. Second tube going in is this one. This is plugged straight into the electricity, and it's a heated pad. Pets coming out of anaesthetic are no different to humans. They need supplementary heat to keep them warm. Their body temperature tends to drop during anaesthetic, and so we keep them nice and warm. Then obviously, to supplement that, we cover them with nice soft fluffy blankets, again to keep that core temperature warm. And lastly, to make sure they're comfortable and they're not on hard surfaces, we have what we call these fluffies, which are absorbent materials that they rest on, and that soaks up any urine that the pet may produce. And again, all focused on comfort, warmth, pain-free environment. So big shout to the nursing team at Devoted Vets, because this is their job, keeping the pets warm, safe, comfortable and pain-free, and they do an amazing job. And when the pet's fully recovered from anaesthetic and ready to go home, again the job doesn't stop. Our team take all the dressings and drips out and deliver the pet safely to their caring owners. And a lot of discussion goes on about the best care for the pet, and depending on the circumstances, that may vary widely. In Poppy's case, obviously she'll be taking it quietly for a few days. She'll be on pain relief. The wound has a dressing and that will be removed. The wound is checked for infection and for bleeding, and then subsequent to that, ultimately the stitches come out as well. So we might ask, a ruptured cruciate ligament, what is that? The cruciate ligaments are in our knee and in a dog's knee, and they run from the front of the thigh to the back of the shin, and another one runs from the front of the shin to the back of the thigh in an X fashion. And they prevent the two bones doing that. They hold the joint stable. And in Poppy's case, she had a big run and twisted sharply and ruptured one of the ligaments, and then her bones, instead of being nice and stable, actually were able to flop around. If that's not fixed, what happens? Arthritis, pain, loss of use of the leg, continual lameness. So it's pretty important to get these areas repaired. Of course, we're familiar with some sports players rupturing their cruciate ligaments, famously footballers, netballers, skiers, but it's not limited to humans. Dogs can rupture their cruciate ligaments chasing a ball, leaping off verandas, leaping up and twisting around and landing back awkwardly. In small dogs like Poppy, the cruciate ligament is repaired with nothing more fancy than really heavy gauge fishing line, and this is placed in two loops running from the front of the shin bone to the back of the thigh bone to mimic the ruptured ligament. What happens to the ruptured ligament? We take that out surgically, because if it's left in there, it can irritate the joint and again cause arthritis. So we thought you might like to see what goes on behind the scenes in a veterinary clinic and the care that they receive in recovery from anaesthetics and surgery. So from all the team here, and of course our little star Poppy, we look forward to seeing you here at Devoted Vets, the place where magic and happiness happens.